Hello, everybody. Rick Manning, President of Americans for Limited Government here. Unbelievably, COVID-19 vaccination discrimination continues in America, even in 2023, with all we know about the vaccine. Some hospitals are continuing to discriminate against those who aren't vaccinated. But Senator Rand Paul, who's a medical doctor, is pledging to do something about it. He has introduced the anti-discriminatory discrimination against unvaccinated bill, along with about 6 other Senate co-sponsors. And, let me just show you what's going on even today. Okay. Okay, I understand they're not able to hear that. So what we're going to do is I'll just go and tell you what the story is. 14-year-old girl has gone through a 2-year process to get vaccinated. To get a transplant for a kidney. She's in a dire situation related to her kidneys failing, and throughout that 2-year period, the Duke hospital system knew that the parents, she wasn't vaccinated, and the parents were very, very uncomfortable with her being vaccinated. And as a result, the Duke hospital system knew this all along. They then failed. They failed to tell them, the family, oh, well, that's a problem for us. They said, we recommend you get vaccinated, but they never said it was a requirement. And right when they're doing the last preparations to be able to get her the transplant, the Duke Hospital came back, and the doctor said, no, if you don't get vaccinated, if she isn't vaccinated, she's not getting a transplant here. So it was straight, a blocking of the vaccination of the transplant based on the vaccination. What's interesting is the American Medical Association has urged physicians to refrain from denying care to patients based on vaccination status. So the AMA is saying, don't deny care to patients based on vaccination status, very clearly. And yet there are cases, and you Google in and you say, and I had a few more to show you, but since you can't hear, I'm not going to do that. But you Google in, video of transplants denied based on vaccination, or based on COVID vaccination, and you get a lot of cases. And these cases have a similar tone. The hospital systems were essentially being told and being pushed by the federal government that to deny medical services to people who were not vaccinated. That was what was happening. It was happening. We knew it was happening in 2021. We knew it was happening in 2022. There were cases of that was being reported by nurses that people were in fact being really shuttered aside and left to die because they didn't have they weren't vaccinated. And this wasn't just with COVID, it was with other diseases as well. So what we're looking at is a wholesale discrimination based upon people who weren't vaccinated. And as time is told, we even have Representative Nancy Mace from South Carolina in quizzing a CDC official last week, saying that she was vaccinated, but based on things she knows, she really regrets having done so. As a healthy woman who's relatively young, the chances of her getting COVID and dying were negligible, and the risks associated with the vaccination, per her statement, she felt outweighed the value that it actually offered. Yet we continue to have this mandate that started from the federal government, where hospital systems are saying, we're not going to allow you to we're going to sentence you to death because we're not going to allow you to get a liver transplant. We're not going to allow you to get a kidney transplant. We don't care how old you are. We don't care any of that. All we care about is you didn't get the jab. Rand Paul's going to do something about this. He's got the Non-Discrimination Act in place. He's introduced it. There are the co-sponsors are Senator Ron Johnson, Mike Lee, Tom Cotton from Arkansas, Marco Rubio from Florida, Cynthia Lummis from Wyoming, J.D. Vance from Ohio, Mike Braun from Indiana, Kevin Kramer from North Dakota. If you have senators who I did not list, you need to get a hold of them and say, you need to get on this bill. We need to put an end to discrimination against people who are not vaccinated by our so-called healthcare professionals. The question is, how did we get here? What happened? And it really goes back to when Obamacare passed. Because when Obamacare passed, what happened was a lot of the individual practitioners, the doctors who were individual practitioners, got a whole lot of bureaucratic paperwork they had to do. And so those individual practitioners, many of them joined larger doctor groups, so they didn't have to deal with all the new paperwork. What that effectively made them was employees to a larger group, and as a result, not independent operators. And as employees, they had to do what the group as a whole said. So when the CDC or the Health and Human Services came out and said to insurers, kind of threatened reimbursement for these hospital systems, for doctors of treatments done for people who aren't vaccinated, by saying they're too risky for the procedures. When those kind of edicts started coming down from the federal government, the big systems, the big hospital systems and the like, responded, and they said, we're going to follow the rules here because otherwise we may not get paid. And so it no longer became about the patient. And unfortunately, what Obamacare did, in spite of the Obama promise that you'd still be able to keep your doctor, you might even been able to keep your doctor. But if the doctor is basically put under the thumb of having to do treatment and conform to what the federal government says, rather than what they view as the treatment appropriate for you, well, guess what? You end up getting government treatment. It doesn't matter who your doctor is, because it's no longer based upon what's in your best interest. It's based upon what the federal government is saying the doctor is allowed, the treatment they're allowed to provide. And we've seen that time and again. We saw it with HCQ, we saw it with ivermectin, and we continue to see it with transplants and the like. And that's why what Rand Paul is doing with this legislation. And on the House side, Representative Dan Bishop has it from North Carolina. So I don't want to leave him out on it. He's pushing forward as well. But the reason this matters is we have to cut the head off of this snake. And this is just one more example of where the head of the snake needs to be cut off. And this will effectively say to hospitals that are getting federal funds, you can't discriminate against people based on their vaccination status. And if you do, we're going to cut off all your federal funds and you're going to have to survive without it. And that's what you can do. That's basically exactly what was done to these hospitals in terms of coercing them to put in these crazy rules and violating the very Hippocratic oath that the doctors took when they got their license. This is so Rand Paul, a doctor, is saying, well, you know what? We're going to make it so you can't, if you discriminate against people based on vax status, we're going to hold you accountable. That's exactly what needs to be done. Senator Paul is doing yeoman's work here and should be praised by everybody out there. I'm going to take a couple of comments because you guys know a lot about this and are weighing in heavily. And that's I think it's really, really important. Ann Barr, why is there no long-term research being done? That's supposed to be a regulation for all vaccines before administering to everyone. This vaccine does not follow this. Yeah, Amy, the reason that this vaccine doesn't follow these regulations is because it was developed under emergency circumstances. As you remember, we were dealing with something that nobody had ever seen before, at least outside of a Chinese lab and maybe Dr. Fauci. Nobody had ever seen before. And so consequently, we were, the Trump administration said, we're going to expedite the process for creating a vaccine. But what the Trump administration did not do, and this is really, really important, what they did not do is they did not require people to get the vaccine. They left it up to individuals to make that choice. It wasn't because remember the vaccine came into play after the election in 2020. So while they were encouraging people to get it, it was a choice. And when the Biden administration came in, they immediately flipped the script and said, no, we're going to mandate that you have to get it, and have taken it down to where many places are trying to mandate that you have to be vaccinated to enter public school at the age of 5, even though there is zero risk whatsoever of children contracting and dying of COVID-19. Zero risk. What that really is a teachers union play saying, oh, we need to protect the teachers from COVID-19, so we have to force all the children to get vaccinated, no matter the risk to the children. And it is an absolute, and by the way, if the teachers were so confident in the vaccine working, then the vaccine that they are taking should suffice in terms of protecting them against said disease. But no, that's not the case. We know that's not the case. We know what the vaccine is doing. We know what it isn't doing. We know the dangers that we're seeing. We know that, yes, there needs to be real long-term research in spite of the fast tracking of the vaccines. Remember, two or three different vaccines, but in spite of fast tracking them, there needs to be ongoing research determining what the long-term effects are. And the fact that the CDC continues to impose guidelines on that our children get it, that our children down to the age of 3 get it, with absolutely no idea the long-term effects, knowing though that there's zero risk of those little guys actually dying from this disease. Zero, is not just medical malpractice. It is akin to genocide, in that this is a mass experiment, and the public health professionals have been proven to be anything but health professionals. All they are is public bureaucrats imposing power. And thank goodness we've got Rand Paul, who has made a lot of headlines taking on Anthony Fauci and the like very directly on this. So that's but yeah, this is one step in trying to pull it back. Let's see here. It's an experiment that doesn't work. Also, COVID was downgraded. Yeah, I mean, I don't know about the date, but clearly COVID-19 has become a significantly less deadly disease as it's mutated, and and there's a lot of reasons for that, but quite honestly, the vaccine was always oversold. It was never going to prevent What it was really, what they always talked about was it was going to, and what all vaccines do is, well, this vaccine didn't, but most vaccines do, is they give you they make you a little bit sick with the disease so you don't get really sick later, so your body knows how to fight off the disease. This vaccine obviously is different in its makeup, but that was a big part of what vaccines are supposed to do. So yeah, we need to know exactly what resulted from this, why they continue to put force feed this into our systems. Let's see here. Nobody will know what they're putting in their bodies. Still won't know for 75 years. And I strongly suspect that we will have pretty good outcome data in 5 years. Unfortunately, that outcome data is disastrous. If the outcomes are, we see a lot more death on the backside based on side effects, deaths that some very, very, very prominent virologists like Dr. Robert Malone were warned against for those who've taken the vaccine. Let's see how. As well, I'll never go back into healthcare. I took an oath to do no harm. Shanatha Metcalf, I don't know what you did, what your job was in healthcare, but I have to tell you, principled people, now we need principled people in this profession now more than ever. We see in places like California, where the California state legislature is, and Governor Newsom are attempting to take away the licenses of frontline doctors, frontline nurses, because they wouldn't comply and were doing what was in the best interest of their patients. And so they're now trying to deny them an ability to practice medicine. In California, in states licensed medical professionals, but I would just urge you to try to find a vehicle to use the calling that you have to help people through medical expertise, through nursing, through doctoring, whatever that happens to be, because God gave you talents, gave you a desire to do certain things, a heart for people who are ill and needy. And I would just encourage you not to throw away the gift and the heart that you've been given, because the government are a bunch of idiots. Okay. So I would implore you to do that. God gave you this gift for a reason. And I just hope that you'll find a way to utilize it. Not vaxxed, not tested. I'm an electrician. 2 carpenters wanted to beat the crap out of me because I'm not vaccinated. But you're scared to go close to me. I think Frederick, you're hitting on something you're talking about something that is a real problem, because what we've seen is the discrimination against people who are unvaccinated, where, ironically, now that the vaccinations, we know a lot more about the vaccinations and how they actually worked. And there's now a big ad campaign. Oh, well, we all have to get along, don't hold it against people and all this stuff. Well, no, I mean, sorry. Yes, we're supposed to turn the other cheek as Christians. So let me just start with that. But understand, the violence on this all came from the left, or those who bent a knee to the government public health monsters. That's where the violence came. That's where the discrimination came. That's where the rationalization that it's okay to have essentially sends people to die because they are unvaccinated. We're going to stop them from being able to get a livelihood because they're unvaccinated. That's where all that came from. And, and I can certainly understand anybody who's been adversely impacted, who's been denied, who's been threatened and been denied a right to make a living because of vaccination status, having a little bitterness in this thing. And those who so smugly lorded it over us and called us names and were just jackasses in general, it's really hard not to wipe the smug smiles off their faces now that they've been proven to be wrong, and now that there is people are coming back in the workplace, and because what you can't undo, you can't undo the damage being done that was done to our children when they were put in masks for a year and a half, when so they couldn't see facial expressions, they couldn't see the lips moving. So we're ending up with massive communications problems with young people, with very young children who need to be able to see the face and to see the motion, see how the face moves, how the muscles move, to kind of learn how they're supposed to do it, because they mimic it, and how they make words and make sounds and do the like. We denied them that in the most formative stages of their life, when their brains were just taking in massive amounts of information. We denied them information. We denied them the capacity to adapt as adults. And we did it deliberately, knowing full well that the masks weren't needed, and the school was needed, and the vaccinations certainly weren't needed. So that is it's the damage done by these public health do-gooder know-nothings has been disastrous. It's been disastrous, and our country is going to pay a price for a long time to come as a result, unfortunately. Amy, that's one of the things that's happening is there's at least on the federal government level, there's a number of pushes in different areas to be able to have people to end the vaccination mandates. The Supreme Court actually went a long way toward doing that. The private sector, it's a little more challenging because private companies, set rules based on federal government criteria, and some courts are trying to decide whether or not people should be paid back pay to be reinstated or not. But it is anybody who is denied their job, denied ability to have livelihood, or if you get sick because you got vaccinated because you were compelled to, you might have a private action against a private company that did that. Unfortunately, you don't have an action against the federal government, because the federal government conveniently protects itself from all civil actions related to stupid things they do. So let's see. Yeah, I have to tell you that the thing that shocked me that I about all this was as much as I pay attention to politics, and believe me, I pay a lot of attention to politics, I was unaware that China had taken over the World Health Organization. And I knew that President Trump basically told them to pound sand and we weren't going to give them any more money because they were useless and they were nothing more than China's tool. But I hadn't realized that they'd basically gotten an appointee in who was essentially allied with the Chinese Communist Party. And as a result, we saw that the World Health Organization was actually fronting for the Chinese Communist Party throughout. And so anybody who wants to go to me and say to me, "Oh, who says this?" I'm going to say, unless you're talking Doctor Who or Roger Daltrey and Pete Townsend, I don't want to hear from you. Everyone that lost their job over not taking the government shot, along with our great men and our forces, should sue the Biden administration for being kicked out of the military. For everyone out there that lost their jobs over it, I know there's legislation that's been proposed to try to, because reinstatement of those military people I think they're being reinstated. The military has a problem because they're running way short on recruitment. And so kicking out hundreds of thousands of people over vaccines is really stupid. And so there's a move afoot to reinstate people. The question is, and there's a fight over whether or not the people who should be reimbursed for their back pay, for their lost wages, for the promotions that they didn't get because of the time, but also the demerits they received on their records for not getting the vaccine, which is a career killer in terms of their ability to be promoted. So that's this was in some ways designed as a way of flushing out people who have religious convictions from the military, and so there's legislation to try to deal with that. I'm hopeful that it will pass, but so far, we're early in the session, so let's see what happens. It's one of the reasons why this Rand Paul legislation is important, because if we can get something like this, which is relatively benign, done, then we can get the next things done, because we have to put our country back together. And it's a little bit like Humpty Dumpty. We can't get it all back together. The last we need is to have a hollowed out military, because we threw out some of our best officers, some of our best soldiers, sailors, airmen, Marines, who weren't vaccinated, and we threw them out because of that. And that's just, it's stupid, it's absurd. And once again, it's our national security exceeds the ability, should be put first, as opposed to the need to make Dr. Fauci feel good about 2 years of terrible decisions that were designed to cover up his culpability and take down Donald Trump from all through 2020. Pamela, I'm going to tell you why we're reporting on this, because if we let this kind of stuff stand when people are still being denied the ability to get life-saving surgeries, if we let that stand and say, this is over and we don't want to talk about it anymore, then good people are going to die unnecessarily because of stupid public health bureaucrats and the inability to get public health bureaucrats to actually do what's in the public's interest and what's in the interest of patients around this country. And so, I agree that if we kind of stop talking about it, maybe they'll stop discriminating. But the fact is, they are discriminating. They've continued discriminating, and they've continued discriminating even in the face of knowledge that the vaccine isn't all that it was cracked up to be. At best, it's mildly helpful, but at worst, with many people in many circumstances, it's death. It's death in a vial. So this is So yeah, I apologize that you wish we could ignore it, but I'm not going to, as long as these public health fascists are still killing people through their edicts, demanding that people bow to the vaccine. So no, I can't be silent when people are dying because of medical decisions made, not based on medicine, but based on a public health edict and people not wanting to lose face. I'm going to, with that, I had another thing I was going to talk about. It was the consumer price index, but nobody cares about the inflation. I'll talk about inflation tomorrow, maybe. But I appreciate everybody's comments, and I appreciate you hanging in. Sorry we had a technical difficulty in the beginning. Had some really great clips for you. You would have loved them. Just go onto any of your search engines and just check out a vaccinated say it's a transplant patient denied vaccination, and you will see exactly why this legislation is so important. Thank you for coming together with us, and we will be back tomorrow with another edition. I may have to do it from Capitol Hill or something, just holding a phone, but we're going to come back with another edition tomorrow. With that, have a great evening.